Hey, everybody. Welcome to The Bar is Open with Beth and Greg. I'm Greg LaMontagne. Today, we've got a special guest in the house, Dr. Arturo Elias from Matador Rehab and Performance here. Thank you so much for joining me.
Thank you for having me.
Appreciate you coming in on a hot-ass San Antonio day. So got you here today. We've got Dr. Elias in-house talk about just rehabilitation, not just sports injuries, but also just, I want to talk to you about like physical maintenance is one of the big things that I think we'll get into today. I've got a lot of kind of, I hope, interesting questions, and then we'll talk some shit about some industry stuff, which I think is always interesting when we talk rehab, physical therapy, all the various modalities as I've been taught as a term of health improvements and stuff like that. So again, thanks so much for coming in. I appreciate it. Do me a favor, give us a little bit of your background. Like what got you into it and what are your professional attributes, so to speak?
Gotcha. So, growing up super into sports and everything, did a lot of team sports, played football all the way up to like my freshman year of high school, and then realized team sports wasn't for me.
Okay.
And I was like, even younger age, I did karate, taekwondo, a lot of, martial arts. And I was like, you know what? I really enjoy the one person, like it's you against your opponent. That's it. So I started doing Brazilian jiu-jitsu, Muay Thai, and then boxing. So that was a big thing. It started probably that journey from 14 to 22.
All
so
right.
I had a pretty big stint.
Quite a while, yeah.
Yeah, I was pretty, I was doing twice a day. Like I was
were training.
I was training. Yeah. So at 18 or 17, I did the Golden Gloves, got a silver medal in that. So that was kind of where I was like, do I keep doing MMA or boxing? Did MMA for probably like 2 more years after I got my blue belt in Brazilian Jiu-Jitsu. And then just realized that there was no money in MMA. And
what year was this probably, you think? Can you recall?
2014, 2015 ish, around there. 2016 maybe. And then I turned 21, had a few boxing fights under my belt. And
were you like amateur or pro? Amateur. Okay.
And I was trying to go pro. We had a couple pro like debuts lined up, and then my coach got bit by a rattlesnake. And he got like sick, hospital, almost died. And this was right during my sophomore year of college.
Okay.
So it was like, where do I go from here? Do I keep pursuing this field where I'm getting the shit,
getting your bell rung all the time?
My bell rung constantly. That's why I have a broken nose. If you ever see me,
doesn't show up on camera. Yeah, it's good.
The left side, actually, this is my good side. The other side is I was like, all right, do I continue to essentially beat my body, or do I go the route of clinical and like trying to help people, kind of help those that are coming behind me and not experience what I experienced, which was poor healthcare, having a bunch of injuries and not finding a good provider that like could help me.
Right.
So went to UTSA, did my undergrad. I was actually pre-PT athletic training. And it was funny. We were sitting in a just general kinesiology class, maybe 300 kids in the auditorium, and the dean of the department comes in, and it's maybe the first week, and he's like, all right, like who's doing this field and who's doing that field, right? And it's like, who wants to be a coach, who wants to be a personal trainer, who wants to be a nurse, who wants to be a physical therapist? Everyone's hand. 300 plus kids. And I'm looking around like with my hand up, like I'm not gonna make this. Like, I'm working a full-time job, 2 part-time jobs to pay for school. And
that's all the competition.
The competition.
All of a sudden you see, you're like, holy
I'm
shit.
like, I'm pushing B's and C's here. Like, like
because you're working your ass off full time too. Yeah, I recognize
homework
that.
and like studying wasn't really there for me. I was like, I have to be at work after this class because I have to pay tuition.
Yeah.
Right. So it was, long nights, long days. And I was like, all right, like, what do I do from here? So during school, actually, I was like, I don't want to do this. So I switched over to strength and conditioning, still did a lot of athletic training classes because they kind of coincided with one another, and did my rotation internship with UTSA strength and conditioning, did the football team there. So I was training all the football team, basketball, volleyball, and cheerleading, which if you've heard me talk about this, I did not like that because the cheerleaders are crazy people.
Okay.
Yeah.
I was like, they still can get it. I mean, those
they were
girls
lifting.
are,
Yeah, they were strong. Don't get me wrong, but they were so flexible. They were just doing stuff they were not supposed to be doing.
Okay.
Like they were lifting barbells like super awkwardly, just doing stuff on purpose though, just to mess with us. And we were like, all right. Yeah. So it's my 5th year in undergrad, and I'm doing my graduate program to continue to strength and conditioning so I can work at the pro level. That was always the goal, work the pro level. And then just realize that it's more political than what you know.
It's who you know.
It's who you know, not what you know.
Okay.
And it sucked. And we were working from 4:30 a.m. all the way to 6 p.m.
Shit.
Yeah.
It's too
And this
much.
was free work. Like, it's my, yeah. But then, once you get hired on, quote unquote, the salary is not good. You're getting a stipend, maybe after 3 years, you're making 40,000. Yeah, it's rough.
Yeah. That's $20 an hour when you step back and think about it for all those hours. Yeah.
Exactly. So that was like, I hit that fork in the road, and I was like, all right, like, you've always wanted to do the clinical, man. Like, do you want to do this, or do you want to go strength and conditioning? And I was actually getting treated still by a Rossi, if you've been to a Rossi.
I have not.
You have not. A Rossi is a group of chiropractors and PTs that do a lot of soft tissue rehab. They do great work.
Okay.
Really good evidence-based stuff. And I had a mentor that I just met there, and we kind of grew, and he took me under his wing. And Dr. DeRoche, if you're watching this, thank you.
We'll push it out.
Yeah. He was like, dude, go to chiro school. Like, you're gonna do good. Like, where you're at right now, you're way ahead of when I went to school. And I was like,
and so basically it's like you used his advice to push you forward.
oh yeah,
Get you ahead.
yeah. He
Took
literally
him 10 years or however long to figure that out. Right.
Yeah. And he was like, dude, if you do it now, you're gonna be good. Like, thanks. Like, I mean,
You wouldn't have thought of it.
I wouldn't have thought. I didn't have the self-confidence to be like, okay, like I can do this, right? And then a couple months before graduation, I applied, I got in, and moved to Houston, and went to school after that, and the rest is history. Now I'm here.
That's awesome.
Yeah. So yeah.
Great background. Gives you kind of an insight to, because you have the training background, that I think that gives you an insight to versus somebody. We're going to jump into this shit pretty deep real quick here in a matter of seconds here.
Yeah.
It gives you an insight into the reality of what is physical therapy and athletic training and rehabilitation.
Yes.
Because not too long ago when I went to a place, I have a history of just like my back gets stiff. I get tight. I sit all day working.
Yep.
Like so many people, right? You're in front of a computer all day long. I mean, you can have folks that are doing manual labor, breaking or whatever it is, landscaping, whatever. They're probably in better shape than I am from that sense, but they're going to have long-term issues versus like mine is like your muscles are atrophying because you're sitting too long. Right. Exactly. So that's where I come in, or that's where my need for like physical therapy comes in. Right. And everybody's got their own perspective on it. And what we're going to try and do is break down some of the kind of the myths and then be honest about some of the realities of it. So I'll give you an example of right before I met you and I was introduced to you through my gym, Submission Concepts. Same deal. My hips started tightening up. My back started tightening up. And I know it's coming on because this has kind of been over the years. This has happened to me multiple times. Yeah. And it's just from sitting. It's my posture. I'm not getting up enough. I'm working 8 hours or 10 hours at a desk and just the bullshit. And I went to kind of a revolving door chiropractor through my insurance company. Right. And it was actually way more expensive. And we'll talk about like out of insurance and insurance and those sorts of things. It was actually more expensive using my insurance than it would be to go to a private practice like yourself.
That's crazy.
But all he did, put a TINS unit on my back, which doesn't really do a whole lot. Yeah. No massage, nothing as far as that to warm up the muscles or anything. And then cracked, just adjusted. Yeah. And that was it. And I was done. Felt great for maybe a couple days, week, maybe. And then, hey, let's schedule your next one. Okay. Let's schedule your next one. I'm like, I know in the past I haven't had to schedule the next one.
Yeah.
In Phoenix, we had a great location that we went to as well. And they were like, all right, get on the bed. It was one of those roller kind of beds that like stretches. Yeah. And it really works, kind of gets you going. You're like, oh shit, that hurt, kind of one of those things. And then they think of other things. And then even at our office, we had somebody that did dry needling, right? But these are all kind of different companies.
Spread out.
Yeah. I'm going to go back a second here, is one of the things that really kind of pissed me off was that revolving door. When I looked around that office, you see everybody there. And it's like, I know they could be healed properly if they had a proper program.
Yeah.
Right.
An individualized treatment program.
Yeah.
Yeah. It's not a cookie cutter. It's like, we're going to do the same thing with Joe Smo.
And that's how it felt.
Yeah.
It was like, they're going to treat 70-year-old dude the same as they're going to treat 45-year-old Greg.
Yep.
Right. How do you get it? I mean, was that one of the big impetuses for you to like learn to do all of it? So if you go to matador.com, rp.com, you can see his facility. It's beautiful. It's awesome. But you do a lot more than just cracking backs.
Yeah. It was because I went through the revolving door. I remember when I was training, I was always hurting. So I was like, I had to go see a PT, chiro, a trainer, and massage.
Right. All independent.
And I was like, why can't I find a place where I can just get all this done? Right. And then they all had ridiculous fees. Right. And they were all feeling like revolving doors. And I was like, man, like I'm over here trying to go pro. And I feel like I can't find a good place in San Antonio to like offer me what I need. Right. And that's what drove me. I was like, I need you know what? If I can't find it, I'll make it. Right. I'll build it. And that was always my goal. It's like, where would 16, 17, 18-year-old Arturo go to go get treated because he's got to fight in a couple of weeks?
Right.
Or he's, I also did a bunch of triathlons like during all this time because of Nick Diaz and Nate Diaz, right?
They're doing it all.
Yeah. I was like, I'm going to be
them.
Yeah. I was like, they got cardio for days. Right. So I was doing a bunch of triathlon training too. So yeah, I could never find it. So I was like, I'm going to just build it. Like, let's just do it. So thank you for the compliment on the facility. That's like 10 plus years of planning and seeing that vision and being like, this is what I want. When you come to my facility, it's different.
Yeah, absolutely.
Yeah.
And that's not just, it's promoting your place, but it's true.
Yeah.
Because I've gone in, let's go through just like my quick like experience there. Right. So went in, okay, my shoulder's hurting or my back's hurting or something like that. Massage, or I guess you tell me, I don't remember. It's like, I've had so many things, I almost threw an F-bomb there, like that have been messed up on me, or like my knee or my back or whatever.
So we'll do a lot of like different soft tissue therapies. So that's what I usually call them. Massage being like some of them, right? There's different techniques to massage, but I usually just call it soft tissue massage. Instead I can get real nerdy and be like, yeah, we're doing ischemic compression and pin and stretch and all. No, it's
massage.
It's stuff,
and
massage.
It sucks usually.
Yeah. Usually it's not a fun one. Yeah. We'll do that. We'll do the dry needling. We do some cupping, which I think we'll talk about a little later. Manual therapy, some static and dynamic stretching. So kind of like whatever I think we need to do, I'll do it. Right. There's no insurance company telling me, hey,
you can only cover these two things.
We're only going to pay you for this. No, because you're coming to me. We're going to have that conversation, right? It's like, what's bugging you? You know what, Greg? I think the best game plan is XYZ.
Yeah.
What do you think? Yes, no, that sounds good, and then we'll modify from there. And I'll be like, all right, well, let's also do some rehab, some exercise. And that's also the big thing, right? It's like, we're going to do our rehab exercises, and then we're going to do some soft tissue, adjust, whatever therapy we needed to hit.
Yeah. So what do you recommend for people that are in that kind of revolving door chiropractic process? You got to keep in mind also, a lot of people do have to rely on insurance.
Yeah, absolutely.
Financially, right? I mean, it's a challenge sometimes. But what other things, and we can get into kind of some at-home care here in a minute, but I mean, how do you pick a good chiropractor versus a quack, so to speak, right?
Yeah,
because there is a stigma with chiropractic care. Yeah. There is. And let me read you this article real quick.
Yeah, please do.
You might have seen it recently. It just came out, and it's scary on, you probably do, but the people don't. And I'll just read it straight up. I just got to find it real quick. So GSU graduate paralyzed snapped arteries after chiropractic visit, right?
Yes.
This was on, I found this, I just happened to be scrolling through TMZ or something like that, right? So a Georgia Southern University graduate is now paralyzed and in the ICU after going to a chiropractor for neck pain, leaving with 4 snapped arteries. Like, how in the fuck how does that even happen?
Yeah.
Right.
Yeah.
On top of, and then it like just spiraled.
Yeah.
On
it's just
her,
like
right?
paralyzed.
Yeah. She had a blood clots and stuff like that.
Which is sad, which is terrible to hear.
I mean, any medical things can happen. I understand.
Yeah. Right.
This just makes huge levels. And then it puts the stigma
exactly
on, chiropractors are just out there breaking your, and it's not the case.
Yeah. So, yeah, I mean, it's different. I mean, I do have a little case study here because that came up and we had a little discussion with me and some of my colleagues.
Okay.
So let me just start with like how to find a good chiro so this can be avoided, right? From ever really
maybe that's the key to it, right?
If your chiro isn't spending more than 20 minutes with you, meaning face-to-face time, right? Asking you questions, being like, hey, like, oh, you have a headache? How long has that headache been going on, right? Oh, you're feeling pulsations here. All right, like, how long has that been going on? Are you on medication? Is there a history of hypertension? If they're not asking you questions, they're just like, oh, you got neck pain? Like, let's just adjust you.
Yeah.
That's when you should be like, whoa, doc, I got some more questions. Like, this is happening, or just honestly, I would leave. Like, don't, just because it's a provider, you should question them, right? I feel like there's a stigma of like, I shouldn't ask my doctor. My doctor knows everything, but you know your body.
There absolutely is.
Yeah. You need to ask those questions. Now, like I said, if your chiro isn't like taking your blood pressure, right? Like checking your vitals, that's something to be serious about because stuff changes as we go, right? You're on medications. If they're not asking those questions, that's when I tell people like, maybe you shouldn't go there.
Okay.
That's the revolving door. That's the, we're just trying to, what's called like snap and crack. Just
there's one, I'm not going to throw them out, but there is a chain.
Yes.
And I went to them one time because I was like, I need to do something. Right.
How long was that visit?
10 minutes, 15 minutes, signed in.
Oh God.
I think I did a little thing online first, like a little form online.
Did you watch a video?
No, I don't even think I watched the video.
Oh, okay.
No, I may have, but it's been a couple of years. So, but it very much was like that. And one person, it's not like I saw any credentials hanging on the wall. Oh, God. You know what I mean? Yeah. But I was like, I don't give a shit. Just fix my back at this point. Yeah. I would have taken somebody just like lift me up and snap my back or, you know what I mean? Like whatever, just to take the pressure off. You know how you did it when you were a kid? Like, I'll crack your back.
Squeeze. Yeah.
Well, put your arms like this and all, So that's great to know because that's one of the things I think when you hit something very important there. It's like with any doctor, it's like if you don't get a good vibe from them or feel from them, you don't have to go through with the care.
This is something big. This everybody should know. Every procedure you get asked, do you consent? Do we have consent to treat you? Right. When you come see me, that paperwork that you all filled out, right? It's I consent to treatment XYZ, but I still ask, hey, we're going to do this. Is this okay? Boom. Right. You can say no. Right. If you don't feel comfortable, say no.
Maybe somebody's not into needling. Like, I think this would be a good idea for you.
Yeah. And I'm like, cool. My hand is worse. Like we're going to,
it's going to suck more.
It's going to suck more.
Yeah.
But I respect that. Right. Yeah. I'm not going to force something on a patient that they don't want to do. Yeah. Even though if I think it's going to help them, it's all right. Well, we'll cross that bridge again. I'm never going to
pressure them.
Yeah. Pressure them to a corner and be like, if you don't do this,
it's going to get,
it's going to get worse.
There's alternative methods to everything, right?
Exactly.
I mean, really,
exactly.
Stretching or
there's different other therapies you can substitute for it.
Yeah.
But I get it. Like some people have their insurance and they want to use it. You pay it every month, right? And I hate insurance. I'm gonna straight up say that. You pay for a service, and
my copay was more
than
what the visits are for like full service.
Yeah,
you know what I mean.
Wild. Yeah.
Yeah. like a lot more too.
Yeah. That's
So,
crazy.
you know, and I've got pretty good insurance.
Yeah. Right. And I mean,
So-
I'm sure you're paying monthly like a pretty high.
Just like everybody. Yeah. Just like everybody.
And, you know, it's just crazy, but I get it. Like, you know, if someone has insurance in their copay, let's say it's $20, right, to go and see a chiro. Cool. I tell them, go for it. You know, I am not offended at all. Like, I would rather you're paying that money, go see them.
Mhm.
However, in a couple visits and you're like going through that revolving door and you're like, dude, I'm not getting better, you know, then come see me.
Yeah.
You know? But I always give them that option. I'm like, I understand. I'm not in network.
But you're the type of thing. So you're out of network, or you prefer not. But you could get paperwork to submit. There's always those options.
Yeah, and that's always kind of a hassle. Yeah, but I mean, it can get done.
Yeah.
So it's not impossible to come see me if you have insurance. We'll give you a super bill. It's itemized. Some insurances will accept it. Maybe give you like 50% of what you
off.
pay. Yeah. So it's doable. But if you got insurance and you're going to chiro, just make sure they're checking up on you, right? They're not just like, all right, lay down, let's get to work.
That's exactly how I felt. Yeah. So
Yeah.
to those out there that, you know, you're going on, a regular basis, and maybe you don't feel like you're getting, maybe switch providers or shop around a little bit, get a feel for them, see what other kind of therapies they offer versus just like a TINS unit and an adjustment or something like that, because there are a lot of different modalities. And I've mentioned this multiple times. Like, a modality is basically like a different therapy type, right? Crystal has talked about this before. Crystal Krinzinga has kind of laid out like, what does that even mean? Because I'd never heard that terminology, right?
Yeah.
And I like to kind of try and repeat and reinforce those types of things. So what is the definition of chiropractic therapy when we think about it from that?
So before I went to school, I have never heard the term quack. Like chiropractic quack. So when I went to school and I told someone that, I was like, oh yeah, I'm in chiro school. They were like, oh, those quacks. And I was like, what are you talking about? What? And because I'd always seen pretty good like chiros, like they adjust me well, they ask me good questions, they give me good advice. It was never like I felt like
there's a weird stigma that just kind of hangs on to that one thing.
Yeah. So there's essentially two sides. There's the evidence based, which is what I'm considered, or I like to consider myself. I practice best evidence based I can. And then there's what we evidence based chiros call is TORs. So chiropractor.
Okay.
So TOR.
Okay.
Where they get more of the holistic. They use the word subluxation a lot, which means bone out of place.
Okay.
Which we know bones don't pop out of place like nothing. So I think I've told you when I adjust you, I'm mobilizing joints. I'm not popping a bone back in place.
Right. Yeah. It's just
we're just
adjustment.
Exactly. We're just mobilizing the joint to move the way it's supposed to move. Right. Where these TORs are kind of saying like, oh, there's interference in the spinal column and there's a subluxation, there's a bone putting pressure on you. So this is happening, and that's why you're having stomach issues, or you're having this back pain, and it's very like some for it. Yeah, quacky.
Quacky. Yeah, you can say that.
Quacky.
But I mean, it's very they don't necessarily pin it down because they want it to be kind of nebulous.
Yep, because they want to keep seeing you.
Yeah.
Right. They want to keep you in their loop.
I don't want to keep going back. I want to be fixed. If it takes me 2 or 3 or 4 times.
Yeah.
Fix it.
Yeah.
If I get hurt again or something happens, I'll be back. That's how it should be.
I think I've told you that. Where I was like, dude, I think this might take like another visit, and after that, you should be good.
Yeah.
Right.
And that's generally how it is.
Yeah. And because my goal is not to see you forever. Right. I want to give you the tools to help yourself, and only come to me when you're like, dude, I am hurting again because I sat in the car for 10 hours and then I moved rocks and then I had to deal with the kids and I didn't do my exercises. All right, dude.
That's usually what happens.
Yeah.
I'm like, shit, I forgot.
Yeah,
I stopped stretching about 6 weeks ago.
So,
yeah. So the definition, like from what you were clinically say, it is. Repeat what you said.
Sorry.
You said it.
So I guess the true definition of chiropractic, when you just separate the two sides, is healing with the hands.
Okay.
So we're just a conservative approach to pain.
Okay.
So we're conservative, drug-free. All we're doing is usually stuff with our hands, movement-based, rehab exercises. So nothing where it's evasive, right? Where we have to like cut you open or pump you full of drugs. It's a conservative route. Right?
Okay.
And that's by hand. So
that's awesome to know.
Yeah.
So I think, again, it comes back to just educating people on what that actually means, the terminology of what chiropractic care really truly should be, right? Is that,
Yeah.
definition.
Yeah, it's just caring for a patient.
Yeah.
Unfortunately, yeah, we've had a few quacks over the years, and you know, it's like we're just looking at them now at this point, like, hey, you guys suck. You guys made this bad for the profession. So we're kind of battling that battle now of like, that's the old school chiro, like 100 years ago, like they used to practice like that. Now we're more evidence based. We do a lot of research. Yeah. A lot of research, and we do therapies that are safe and effective, you know, and provide
Proven.
Yeah. So that's the goal. Now with that article that you talked about,
like how did something like that fucking happen?
So that's the thing. Who knows? They're still like it's still early.
Those, you know, like
I mean, you've gotten choked out, right?
Yeah.
Right. There's this awesome picture. I'll share it with you later, where of a dude like getting choked out, and some chiro made a funny like joke. It was like, oh yeah, but you say like adjustments will kill you, right? And it's like a dude getting like
his head's twisted off.
I mean, he's in an anaconda, right? Like just getting smothered. So who knows? Maybe the chiro missed something major in the history. Maybe he didn't perform a good exam. Maybe she's just like, my neck hurts, and like
there could have been a pre-existing.
She might have already had it, right? And he just provoked it, or maybe she was on medication and didn't say that she was on blood thinners, or like
there's a lot of
So there's a lot of like stuff.
And that's why it's important. I get again to let your qualified provider know.
Yeah,
and don't hide anything and be like, oh no,
so
I was in a car accident. I forgot to tell you.
Yes, exactly. So
because I didn't want to tell my mom that I was in a car accident or something stupid.
So yeah, again, right, being honest with your provider also. It's like even if it's like minute, whatever, like you said, car accident, right? Or I fell down the stairs. I've had that twice, where someone got kicked from the top of the stairs, fell all the way down, hit their head a bunch of times, and like I was like, dude, this guy isn't right. Like something's up. And then he's like, oh, you know what? I did get like kicked down the stairs last week.
Like what the?
Yeah, I was like, I just asked you if there was any trauma? Did you just fall or anything? And he just forgot, right?
Because he still
probably
has a CTE from that.
Yeah, exactly. So stuff like that, right? It's like people think, oh, it's a chiro. They're gonna just adjust me. They're gonna do some soft tissue
without even asking questions.
Exactly. But there's contraindications that we need to know, which is why we ask you certain questions.
Yeah, because if you have a pre-existing spinal injury or something like that, that's a huge risk.
We got to know what's going on. So that's why my intake form is pretty like
elaborate. Yeah,
and I'll still ask you questions.
Yeah,
right. But there's this article that goes with that actually, with what you showed me.
Okay.
And this is a PubMed. If anybody knows what PubMed is, it's a medical journal.
Okay.
Just research based. So
when we're done, send me that link and I'll link it into the notes.
Yeah. So the title is called "Risk of Vertebral basilar stroke," meaning what that female had.
Okay.
And chiropractic care, result of a population-based case control and case crossover study, meaning they just studied millions of people regarding the chiro care. So the conclusion is the short term is a VBA stroke, vertebral basilar artery stroke, is a very rare event in the population.
Is that like the back of your neck? It's like, is that in the base of your neck?
So you have the aorta coming up, and then it kind of splits up, and then you get your two spinal, and then at the very top you get like deeper in there.
Into the Yeah,
it's a whole web.
That makes sense.
Gnarly. Yeah.
Go pull up a venous system of the brain or the head. Yeah.
Crazy. And we had to learn it all. It's crazy.
Makes sense.
Yeah. But the increased risk of VBA stroke associated with chiropractic and PCP, which is primary care physician visits, is likely due to patients with headache and neck pain from a VBA dissection seeking care before their stroke. Meaning you have a headache, you have head pain,
I see what
and you're like, I'm going to go get treated by my chiro, or I'm going to go to a primary, right, to go get checked out because I don't feel good.
Yeah.
Right.
But there's it's
there already, essentially.
It's happening. And it's not that it's misdiagnosed. It's just
like when you take a pain med, right? There's all the side effects, right? Yeah. So the risk of going to a primary and a chiro when you're experiencing these symptoms, it's about the same.
Okay.
Right. So it's not the therapy so much. It's usually more the symptoms that you already have. Yeah. So you're probably
already an ongoing condition.
It's already probably there. Right. Okay. And now you're seeking care. And unfortunately, maybe this happened.
It triggered it.
Okay. Yeah. And then, but the forces of an adjustment are super low. So even saying that an adjustment can cause that is crazy. Like, to a degree.
That's what I was kind of thinking, like going back to that as like,
how does that cause that?
Like it makes it sound like the guy wrung her neck.
Yeah.
Like he just spun her head around exorcist style.
The
right?
forces of an adjustment are super.
No, I've been there.
Yeah.
Yeah. Like a lot of times you have the drop tables like, and it's
Mhm.
just like, it sounds
crazy.
louder,
Yeah.
but the back's only going like,
Yeah.
and there's
crazy.
nothing to
Yeah.
it, right? Or it's a,
Yeah. So
You know?
it sucks that this happened to her, and
Yeah.
now the stigma. And I mean, it's a headline. It's a great.
it's a
sounding
fucking headline.
It's a great.
That's what I was saying.
headline.
It's on TMZ.
Yeah, exactly.
Girl
right.
paralyzed from chiropractic
Yeah.
visit.
Yeah.
Well,
Not,
no, she had other
Mhm.
extenuating circumstances,
that,
potentially.
like hundreds of people die from taking NSAIDs every day. Right. Like,
Yeah.
hundreds of people die from NSAIDs. Just normal taking it as I have, as recommended, die. Boom, that's it. Right. Like
Yeah.
there's hundreds of people that just
And we
die.
have one that,
So
again,
in the last 125 years that chiropractic's been around, there has been, I think, 25 total possible cases of poor outcome.
okay.
Meaning like something like this happened in the last 125 years.
So in this, yeah,
It's
so you go
wild.
back and you go, okay, it's like
It's wild.
you could be eaten by a shark and hit by lightning at the same time.
Yeah.
Probably less likely.
Yeah. So
When you think of the number of patients
exactly,
they're going through.
if that many chiropractic patients were having strokes every year, I wouldn't have a license. If you think about it, like
I don't think anybody would have a
Yeah.
license.
yeah,
Definitely.
exactly.
They'd be
right.
like, it's too dangerous.
It's too dangerous to treat that. So it sucks. It's a headline.
Yeah.
At the end of the day.
Awesome. Thanks for clearing that up a little bit and just kind of putting a little bit of calm out there because again, you see some of that and you go, holy shit.
Yeah. It's like I don't want
So different modality.
to.
Number 2. So you got chiropractic, the adjustments, acupuncture versus dry needling.
Okay.
I love dry needling.
Uh-huh.
It is one of the craziest things. And I was introduced to it by a physical therapist out in Phoenix initially, right? And that was where Beth and we moved here, and it was up until like a year and a half ago when I met you, something like that. And we couldn't find somebody who was doing dry needling. But I'd had tennis elbow, I'd had my back, dry needling. She's like, have you ever thought about doing this? She was the only one that would do it. And we were always like, get me in, right? Then when I found out, I was talking to some folks over at Submission Concepts and like, oh yeah, he does this too. And I was like, oh shit, yes. So real quick, the difference, if you've never heard of dry needling, it's more intense, but I've never done acupuncture.
Okay.
So I think people think, oh, he's just sticking, or you don't even know.
Yeah.
Explain what dry
they are.
needling is.
Yeah. So acupuncture is more the Eastern medicine,
Yeah.
Asian based or Asia based or
Whatever it is.
whatever, Eastern medicine. And then dry needling is more Western based. Kind of came up around the 80s
All right.
by physical therapists and a couple orthos. I think in Lubbock, actually, if I'm not mistaken.
Really?
Don't quote me on that. Yeah.
It's a
Yeah.
random ass
I know.
place.
I know.
It was like, oh, it feels great.
Yeah. So, I'm nerd out a little bit. So dry
Fine.
needling came about because they were doing trials with wet needling, which is steroid injections, which is just a normal,
Oh, okay.
which is the normal shot.
All right.
So they're like,
Never heard that uses that term. That's
yeah,
cool.
yeah.
A wet
So
needle.
dry needling is because there's no fluid being injected into the site. It's just a needle itself penetrating the tissue.
Right.
Now, they were finding outcomes from both the dry needling and the wet needling, right? Or the injection with fluid, right? They were having the same outcome for both cases. So
Okay.
like a patient comes in, oh, my shoulder hurts, right? Another patient comes in, my shoulder hurts. One patient gets the wet needle, the other one gets the dry needle. And they both had good outcomes.
You just made it like, okay, that's why it's called dry needling.
Yeah.
I've never heard that
That's why
terminology.
it's called dry needling. Because there's no fluid, right?
There's no fluid going in.
yeah.
So you're
But
not getting a shot to temporarily solve the issue.
Yeah, exactly. Where like an injection, the wet needle, maybe it's a steroid shot. They're gonna inject some fluid in there. The fluid is actually the one doing most of the work. We're dry needling. We're going to the muscle tissue, right? We're targeting trigger points, quote unquote adhesions, tight musculature, and just trying to get some healing factors. In
Okay.
there. Now, that's where dry needling kind of came from in the 80s, developed by PTs, and then kind of took off from there. We use acupuncture needles to dry needle. So the needles are the same for acupuncture and dry needling. So they're very small, monofilament.
Very thin.
Very thin.
You don't
So
really feel them go in.
Mhm.
You feel them hit
the point.
the point. You're like,
like
yeah,
going
I'll get
back
into
to the
that in just a
spot.
second. Yeah.
Yeah. So, for those of you that are like, scared of needles, these needles are 4 times smaller than an injection needle. So if you got your COVID shot, it's 4 times smaller than that.
Okay.
So very small. Now, acupuncture is, again, more of the Eastern medicine. It's more holistic. They use what's called chi, right? And meridians, meaning chi flows through our body. There's different points in our body that are called meridians, and they're trying to target those meridians, maybe because there's toxic stuff in your blood or in your organs, and they're trying to hit different points
To draw that out.
to
or
draw that
something
out
like
and
that.
heal it, right?
Okay.
So like there's a few in the hand, and there's points everywhere that
Okay.
the Chinese medicine has used. And it's been around for thousands of years, so I'm not discrediting it at all.
Yeah.
But some of their points are wild. It's like gallbladder 47, and it's like here in the elbow. And it's like there's one here in the one of these hands that like helps with pregnancy, quote unquote. I don't know.
Okay. Yeah.
I don't know.
I mean, we don't know.
We
Yeah.
don't know. Yeah. So
They've been doing it for, like I said, thousands of years.
thousands
maybe.
of years. Yeah.
It works
It's
for some
obviously been
people.
around. Yeah.
Oh.
So the way acupuncture for me, when I explain it, I am not certified in acupuncture. I don't want acupuncturists coming after me. And is more of a relaxing, like holistic healing approach.
Okay.
Where dry needling is a little bit more aggressive. We're going to the tissue. So if like you had the elbow pain, right? We're going to go to the site. If you have lateral elbow pain, we're going to target the origin and the insertion of the muscle, right? I'm going to use the anatomy to guide me where I'm going to put these needles in, and we're going to target that area. Where acupuncture would be like, well, you know what? This point fixes elbow pain. So they're similar on that aspect, but that's kind of it. They're more superficial, where dry needling is deeper.
That's it. So we can move to that. Yeah, absolutely. So thank you for kind of clarifying the difference, because again, people, they're like, a lot of people don't even know what dry needling is. And I didn't even know what the difference between, you just told me wet needling, dry needling.
Yeah.
So me being introduced to it, I'm dead. I love it. Like when I have like a deep tissue, I'm like in my shoulder blade or something. You can't, like, one of these things, we'll go over this in a minute, doesn't do it.
Yeah.
Or Beth digging her finger into it's just not cutting it. Or I've tried racket balls, or I've tried everything.
Yeah.
It just doesn't get to the point. That's where like the dry needling for me comes in. And it's, you really pinpoint that particular muscle, and they'll spin the needle in it, and it literally, you can feel the muscle grab onto the needle. And it's the weirdest thing, because you'll be in, it's either, it's like a fight or flight kind of thing. You're either going to laugh or you're going to cry in a lot of these cases. Right. And he's done it down my leg, and I'm like, oh shit.
Yeah.
Right.
Intense, yeah.
And it can be intense, but as soon as the muscle relaxes, you're like,
it gives.
It doesn't even, it's just gone.
Yeah.
So it'll be pulse. Like you'll add what do you call
E-stem.
What is it?
Electric stimulation.
Electric stimulation to it. And my leg will be jumping, and then all of a sudden it will just stop. Yeah. It's relaxed.
Yeah.
So it is an amazing, amazing thing if you have like certain particular areas of anywhere on your body.
Anywhere,
part, right?
Yeah. So anywhere from like the jaw, TMJ.
I wouldn't even have thought of that. Yeah.
So we'll do TMJ, occiput, which gives a lot of headaches to some people.
Okay.
Neck, fingers.
Is that like just real high because of like?
There's a small little group that's called the suboccipital musculature and region. It's so small, but it does about like, I think, don't call me on the number. It does the majority of our rotation of the head, right? So these these 4 muscles that are up there in the base of your skull.
Okay.
Yeah. So if you ever touch that and you're like, ooh, that's tender.
Yeah.
Like, I have a headache here. It's probably your suboccipital region. It just tightens up, right? We're either here all day, or maybe, looking at, I don't know, the screen.
Just you're sitting in a static position for too long or something like that. Yeah.
Exactly. Yeah. So that area. But yeah, like the dry needle, like you said, the clockwise, counterclockwise is what I call it when we're spinning the needle. The fibers of the muscle.
And it reactivates, and you're like,
yeah. And you get that twitch response.
There's no joke. It's like you will jump, and you're like,
and that's the twitch response, where it's almost like a reset of the musculature.
Yeah.
Where it's like, okay, I give up. I don't want to harm him anymore. And then the E-stem comes in, and it fatigues the musculature, and it lets it almost reset again. And allows the body to finally be like, okay, like I've been like this with my shoulder hike. Now I can kind of relax. Yeah. And we've had some crazy, like, just in-house like cases where like I'll needle a certain area, and like they're like this, and they're just like, oh,
they can move their head. All of a sudden they've got this range of motion.
Exactly.
Right. And I think that's huge because like I have limited range of motion with like my right arm. Right. And that's probably it's joint issues, but this is beyond little kid injuries, getting into fist fights and dislocating my elbow, my shoulder and stuff. But even doing some of that, like when we do some of the treatment, I'll get bigger range of motion, even in a shoulder that's kind of locked up for a little bit.
And you do jujitsu.
Yeah, and I do jujitsu. So there's a lot of stuff like that. Like it happened to me last night.
Yeah.
Big dude just fell on my arm, and I was like, "Nope, tap. I'm done."
Yeah.
But yeah, so again, it's another one of those things that people should definitely look into because I don't think a lot of people really know about it. You know, and is it something that, like you said, it's been around since the 80s. So that's 40 years ago, really, or 30, 35, 40 years ago, whatever it is. Is it becoming more common practice where you see it with like your you know,
so
people you are affiliated with?
It's definitely been more, it's been coming more to light now, because it's more available. There's more courses for providers to take. There's still some states though that don't allow it. Like New York actually just took that away from PTs.
Oh, really?
PTs aren't allowed to dry needle anymore, which is crazy to me. Just sounds crazy.
Well,
it's New York. So yeah. Make your words not mine, but I agree. Texas is an amazing state, obviously. So as chiros, we can dry needle, so can PT, so can athletic trainers.
Okay.
The supervision of a DC PT or a MD. So like Crystal can dry needle under.
Oh, okay.
Yeah, so she can dry needle under the license of a physician. So it's great. But yeah, it's definitely like a new modality that's like been picking up steam because people are seeing these awesome results like you have.
Yeah. 100%.
Yeah.
And it's never moved to New York.
Yeah.
Just because. Yeah, dry needle.
Yeah.
Just anything else in life.
Yeah. But it's not just injury or like muscle tightness or a strain or anything.
Okay.
I do it a lot for my post-surgical patients. So yeah.
What kind of cases? Like would you
my favorite one is scar wound healing. So like
Oh.
you get a pretty big suture, maybe you had like ACL reconstruction and they nicked you open and you got this gnarly scar kind of growing in.
Okay.
I'll go in, dry needle around the scar to help with scar formation. So
I don't even know what that means. Like to spread it out,
almost to flatten out the curve. So if you've ever seen someone
like they get a big, deep, like a heavy, fat scar,
even what's called a keloid, where it'll like pop out.
Yeah, that's what I'm kind of thinking. Yeah.
Keloids haven't shown that great of outcomes with that, but like surgical incision scars have, where like maybe it didn't grow the greatest, and you got some tackiness.
Where it's tight.
Yeah, it's just tight.
Yeah.
And the scar and the tissue's being pulled, and people are like, man, I can't extend my elbow, right?
Because it's just tight.
It's just tight.
The skin's tight at that
exactly,
point.
Right? They cut you open, there's a wound there, it's trying to heal, and the body sent a bunch of scar tissue there to hold it together, right?
Yeah.
So now instead of having full range of motion, maybe you're just here. And that's as much as we get. We'll go in there, dry needle around there, trying to get, I always explain it like this. This is a normal scar.
Explain. So you're holding your hands, like your fingers together.
Yeah.
This is go out to audio.
This is the scar here. And right in the middle of my fingers. Now, imagine this is a good scar. It healed well.
Yeah.
And then the poor one would be like this.
Like knotted up. Knuckles up.
And it's just like, all bounded up. And there's not a lot of give. So the tension is really aggravating and causing a lot of stuff.
Okay.
The needles, then I'll go around the area of the scar and I'll try to get it to flatten out.
That's cool.
Yeah. So there's been some awesome cases I've had from people with knee surgeries, shoulder surgeries, where I've gotten them like good cosmetic outcomes.
I've never thought of it as being able to be used. I guess I've never had to.
Yeah.
But that's a really interesting kind of additional use case for it because when you always think of, I got a MCL tear and I had to have it repaired, or I got a rotator cuff injury and had to get it repaired. Yeah. And you don't think of, the skin's going to get, if they have to cut part of the skin open, that's a huge, that's a big injury.
Yeah.
Like if you got a bicep tear or something like that, well, that's a big reconstructive kind of thing.
Yeah.
And being able to do something like that.
Yeah. I mean, both from like a functional standpoint and it's usually more of my female patients that are like cosmetically. They're like, I hate the way.
I mean, guys, if you're in jujitsu, or you're 45 like me, I don't know that I'm getting cosmetic surgery. I don't give a shit. I'm still 45 and I do this shit for fun, right?
Yeah.
But you go like, no, but that's reality.
Yeah.
It's like a lot of women will want.
Yeah.
You know, that's fair. That's fine.
Exactly. And you know, it's great seeing like,
and it's not having to go see a plastic surgeon.
Exactly. I am 1/20th the price of a plastic surgeon.
Yeah.
Right. And then I'll also give them like techniques to do some work, some scar work, some gels. Usually I like to use arnica gel, which is a great like, just gel,
just
substance.
for wound healing,
like
that.
Scar, just to massage
tissue.
yourself. Yeah. So dry needling is great.
That's interesting. I'd never even thought of that. So that's something else that, because you figure, you know, if you have people in, especially in, you know, aggressive types of sport, any sport, doesn't have to be an aggressive sport. I mean, you can get hurt. Like Beth got hurt fucking playing kickball like 10 years ago. She like completely tore her groin. Tore her groin.
Yeah.
Thankfully, she didn't have to have surgery, but it was bad for a long time. I mean, her whole inner thigh was black.
Yeah.
For, like the black of my laptop. Like it was bad.
Yeah. That's
what I'm saying. That could have been a use case potentially for something like that.
For sure.
Too.
So like, that what's called edema, right? And hemorrhaging within the skin. Dry needling is great for that. We surround the area, put the E-stem on there, and we do a pump effect to drain some of the blood out of there using the lymphatic system.
Hear that, Beth? Just kidding. She's downstairs.
So that's me nerding out. I love dry needling. I think there's probably a lot more capabilities for it or use cases for it. And it's just educating the public and saying like what it's good for and what's not good for.
Yeah.
Right. But some people are scared of needles, and I'm like, I get it, dude. We're not gonna do it. Let's use my hand or a tool. And but I always tell them this. I'm like, my hand always hurts. It hurts more than my needles, like because I gotta push harder, right? I gotta get to those.
I can't get into that point. I've got to use the outside force to get to that point, and I've got these dull instruments.
Yeah, it's these
versus
broad. And like So I always tell them that, but you know. We do some motion when I move in, and we go do our exercises.
Yeah.
Right? So we still have good outcomes with that, but it might just take me a few more visits to do that.
Yeah. Versus if you could knock it out in one or two,
yeah.
Versus 3 or 4,
exactly.
Potentially. So keep it in mind, everybody. If you get the opportunity, and that's something that you're willing to try, and you haven't tried it, just think about it, because I think there is. For me, it's been good. It's been a good experience.
Yeah. Same. I'll needle myself all the time. So patients like. You only do it to me, and like I'm like, I do it to myself.
Really?
It sucks. Oh, it sucks because I feel the needle going in, and I do it, and like it's the worst.
That's
the worst.
Masochistic.
Yeah,
is what that
it really is. But if I got to do it, man, I got no one
I know.
to
You don't have anybody else to do it, so
it sucks.
Yeah. So cupping.
Yeah.
All right. So cupping is where you see. If you go Google it, you're gonna see the crazy shit online, because people take this
too far.
Way too far.
It's ridiculous.
Right. But the idea is that, so if you've seen it, it's like these little plastic suction cups, and they'll put them on the back or wherever, and they'll like suction them a couple times. Right.
Yeah.
And what's the purpose of that as well?
Yeah. So there's 2 versions. There's
another beer for.
Oh, you're good. I'm so
you got some?
Yeah. Thank you. There's 2 versions. There's a glass one that uses heat.
Okay.
Which is a little dangerous because glass can break and the heat can burn you.
Yeah. That makes sense.
If someone's doing that to you, just be careful. Or say no.
Yeah.
Right?
Yeah. Plastic's probably better.
Plastic is a better option. It uses a suction pump, essentially. It just takes.
Oh,
air
I see.
out.
So it's just glass, and then they use the heat to then. Okay.
Yeah. But there's risk of burns. There's risk of the glass breaking and falling. Right. And if you know, it can cut you. There's blood. It's just a mess.
That's fair. Yeah.
Now with the plastic, the risk of the glass breaking is less. You can also control the amount of suction you're putting in.
That's what I think I like that. Yeah.
So the intensity. So I'm pretty conservative when it comes to that. I try not to pump too hard, right? I always gauge them like, how does that feel? Is that too much? I'll do like 1.5 little baby pumps. And that's about as much as I do. Now cupping for me, the way I describe it and the way I tell patients that why I'm using it. Well, there's a few different. I'll tell you all the reasons I use it. Usually it's following like manual therapy. After I've been like pushing on the tissue, I use the cup to use a decompressive therapy. So instead of me pushing with my thumb, now the cup comes in and lifts some of that area. And
is it lifting the skin? Is it Is it separating the skin from like the muscle tissue to give space, or?
Yes, to a degree. So there's skin, then there's different layers of the skin, right?
Yeah.
You got your epidermis, your dermis, fascia, which is the thick connective tissue, and then the muscle.
Okay.
Right. What we're trying to do is separate those layers from one another from the musculature.
Okay.
Right. And if your provider or practitioner is evidence based, they're usually going to add some motion when you're on cups, right? I'll put one maybe on the trap.
You had me do that. Yeah.
And we'll do some motion with it, right?
Move your arm this way,
Exactly,
lean this way.
Exactly. Because I'm lifting the tissue around the muscle so the muscle can move again.
Okay.
Right. Without being irritated, right? Without that pressure being there. So that's one method of it. The other method is we'll do like just some general decompression because they're having chronic pain, right? It desensitizes the tissue. So if someone comes in, they have a history of a pretty big motor vehicle accident, and they're just going to have chronic pain for the rest of their life.
Okay.
I hate to say that, and I hate those cases.
In
But
some cases, it's just reality.
happens,
My
man.
mom was like that. She got in a head-on collision, and she just, it
right.
just was, and she was a little woman,
Yeah, man.
you know, and it's just,
It's rough.
and this is back in like the mid 80s.
Yeah.
There wasn't a lot of
There's
this.
nothing
It
else,
was
which is terrible.
take some ibuprofen and
walk it off.
yeah.
So there's just general like palliative care from it, right? Which is why like massage therapists like to use it because it just feels good.
Yeah.
It desensitizes the tissue, meaning something was bugging you here. We put a cup there. We lifted the tissue. There's sensors and certain like receptors in your skin that tells you there's pain here, right? You put your hand on a hot surface, it's hot. You pull it off, right? Same thing with pain. There's pain receptors. So the cups are almost like desensitizing those receptors and saying like, there's no pain here. You're good.
That's cool.
That makes sense?
Yeah.
So the cup is saying, we're okay, right? We're going to numb you out a little bit and we're going to let you relax, right? So that's my two reasons to use cups.
Okay.
Decompress tissue and then desensitize tissue. Now there's some, I'm just going to call them quacks.
That's fine. We can use, that's a technical term, I think, at this point.
There's some quacks out there that will say like, oh, it takes toxins out of your body and it.
So that's my next kind of, that's like the next question on my list of shit, right? Is I was Googling just for some pictures, right? And I was like, I can't put that picture on the screen because it's just.
Was it bloody?
It was disgusting, right? And it's like they sucked, like it looked like they just pulled 3 inches of skin up into that thing.
For what?
And it was gory.
Yeah.
And that is not that's not the experience. So if you're having that done, that's next level. You're doing that for another reason.
Yeah.
Like personally, I think you're doing that for some other reason.
The practitioner's doing it because it looks cool.
Okay.
Put it that way.
Yeah.
I mean, not to throw anybody.
Like literally you had him on my back for what, maybe like 7-8 minutes.
Yeah. With movement.
Doing that, like set him there. Now move, do this stretch, stretch. Okay, cool. Pop him off. And you get the cool little circle marks. So it says like you went there and you did it.
I got it done.
Yeah, I got it done. You know, the Michael Phelps with all him.
Yes, that kind of made it famous. Yeah. But I'm looking the whole time. If it gets too dark, I take it off.
Okay, yeah.
I take it off.
That makes sense because it's rushing blood into that section.
Exactly. And some people put them on too tight.
Maybe it wasn't even 7-8 minutes. I don't even remember. It's a couple minutes or something like that.
I never go more than 8.
Okay, yeah.
That's my limit. Yeah,
all right.
Never more than 8 minutes. But some people put it on too tight where it cuts the skin.
Oh, you don't want that.
Yeah, you don't want that, and you get an abrasion or a good cut in the tissue, and then it starts bleeding. Right? I've had a couple PT like friends tell me like, oh, I put it on this 80-year-old, and
her skin fell off.
Her skin ripped, and she was bleeding in my office. I'm like, well, how many pumps did you give? She's like, 2 really big ones. So I was like,
her skin is like paper thin anyway.
Exactly.
Come on, bro.
Very fragile.
You know what I mean?
Right?
You gotta, like my father-in-law just walks by a wall and like his arm falls
exactly,
off.
right? Or and they're on medication.
And
probably,
then he's on
right?
blood thinners, right? He's on aspirin or whatever.
Yeah. So
you have to be very, very cautious. And that's really knowing your client and knowing
and that's having a good provider that looks at your history, asks those questions. Are you on medication?
Yeah.
Right.
Because even something as benign as you would think is cupping.
Yeah. There's adverse risk.
There's absolutely.
So there's a saying that we used to say, or my professors used to tell me in school and the clinicians, it's like a monkey can do my job. And it's true. I can teach a monkey to adjust, cup, needle, do everything. It's when not to do it.
That's a great point.
Separates me from the monkey.
Yeah.
Right.
The cognitive ability of
to being like, you're on blood thinners, you're an 80-year-old, XYZ, whatever's going on.
Yeah.
Right? We're not going to do these therapies because it's going to make you worse. Right. So people have to be careful when they're seeing somebody that they're not just like, kind of,
it's a one script covers everybody,
right? The revolving door type thing.
Yeah.
It's like, come in.
Even if you're doing great care, you're doing all of the things.
Yes.
They have to be very specific to the individual.
Yes, exactly. Because then that's when you have these adverse risk and events. And because why? Because you were lazy, because your provider was lazy, that they didn't want to check. They just wanted to cash the check.
They wanted the check.
They wanted the check, but they didn't check on you.
Yeah, that's interesting to know. So again, it's one of those things you can go out and look at different, like the proper ways for cupping and the improper.
Yeah. So remember,
applications, I guess.
Yeah, I always say less is more, right?
Absolutely.
I can always go up more.
It still
but I can't
sucked
go
even when it was like super light.
Yeah.
Because it's like, okay, you've got, I don't know, 8 or 10 of them on my back or whatever. And then you're trying to stretch through that.
Just tension.
You're like, oh, son of a bit. But it feels good. You're like, I feel so much better now, right? And it's at the end of the kind of the whole procedure, right? When you've gone through, you've massaged, you've done the dry needling, with the electrolysis, you've done the cupping, we've worked on mobility. The next step is really the prescription of what do we do at home?
Exactly.
Right.
Yeah.
And that's where I think it's kind of like flossing your teeth.
Yeah.
Right. Yeah. It's like, okay,
you got,
and I'm as guilty and he's my doctor.
Yeah.
So, I'm as guilty as anybody, but I'd still try and incorporate some of the pieces.
Yeah.
Like some of them I'm like, okay, I'm better now. I'm better, quote unquote, better now. But I know like in 3 days, I'll be like, oh shit. Right. It's just how it goes. So like really following through is hard for a lot of people. It's just because you're like, oh, I don't have the issue anymore. Yeah. But it's the self-care maintenance part of it, right? The self-care portion of it. That is huge. Yeah. And I don't know how, I think everybody's guilty of it.
Yeah, absolutely.
So
you're asking like, what's the best way to incorporate it?
So like we've got foam, like we've got like this thing.
Yeah.
The drill from hell, right? That you can get this thing going. Like it's the, what are these things called? I don't even know what the hell they're called.
Percussion gun,
right?
Yeah.
And you use this, you'd mentioned to me, because I asked you very specifically, we got one of these. And it's, if you go out, you can find them. It's one of the little drill guns, massaging drill guns, if you can't see it on the, if you're listening in. But you can get them pretty much anywhere now. But you had mentioned to me like one of those, like not doing it for more than 5 minutes on any particular area, because then you can start bruising.
Yeah. Think of it, the simplest way I like to say it, or tell people is like, you ever tenderize meat, right? You're just mashing it, smack out of it, right? There gets to a point where it's just too much mashing, right?
Yeah.
You're causing more damage than good, right? This should be more of like, we're bringing awareness for the body to be like, hey, this is tight. Let's,
flood it with some blood or something.
Yeah, let's get some stimulus to the area and maybe move it around a little bit, and we're getting that percussion, and then move on, right? Because us doing that isn't taking care of it long term.
All right,
right? It's just a Band-Aid for now, but it feels good. It feels good.
Does. It loosens it up.
It loosens it up.
That's fine.
But 30 minutes of that is a no from me. It's a no from me, dog.
Right. Yeah, that makes sense. What about like foam rolling?
I like foam rolling. In the sense that it puts us in positions that we're not normally in. Okay. Right. Now, some people are like, oh, it breaks up adhesions. And
it's like I use it to crack my back.
Yeah. You're mobilizing.
Like just, not necessarily crack my back, but you can hear my back. It's like a xylophone. Like,
Yeah. And,
and it feels great.
Yeah. Go for it. Like, just don't force it. I always tell people, do not force something.
Because don't try and push yourself over. Just go easy.
Yeah, exactly. Don't like twist and turn violently trying to get that pop. It's you're gonna hurt yourself. You're gonna sprain something.
Okay.
But no, foam rollers are great. You're mobilizing tissue. You're putting yourself in the position that you probably haven't been in all day. Like you said, you usually sit at the computer for 8 hours a day, right?
I've got a foam roller. And I have a workout room right back here. It's right back here that I'll go in once in a while. And
there you go.
We have a foam roller downstairs in our bedrooms for Beth to go and do. So we've got
So it's a good tool if used properly.
Okay.
Right. Like you said, you can just lay on there, your back, and like get a couple cracks.
Yep.
Cool.
Just kind of massage, loosen it up a little bit. Hip flexors.
Exactly. But if you're pinning like a muscle,
bands.
and like adding some motion to it, right? And now you're almost doing like yoga on the foam roller. It's a great tool.
Okay.
Right. But that's also maybe asking for help and asking somebody like, hey, can you show me how to do a foam roller? or how to use
That's
it
a good
properly,
point. Yeah,
right?
yeah.
Or just YouTube a video and like
There's
how to foam
tons
roll.
of them.
Yeah, there's
Yeah,
I mean,
tons of
we
stuff.
have the internet. We have what we call Jesus phones. I call these Jesus phones, right? Like you can do everything on this. So just finding, some good information out there, right?
Okay.
Doing your research. But no, foam rollers are great. Now there's some people that's like, oh, it breaks up like scar tissue and adhesions. It's not doing that. It's just mobilizing you, putting you in the position that you haven't been in all day.
Okay. It's good to know.
So yeah, it's a feel good thing. It's a good warm up. It's a good cool down. I think it's a great tool if you're not doing anything, add it in. If you're doing a bunch of stuff, still add it in.
It's just another
tool in the belt.
tool in the belt. Okay, cool.
Yeah.
What about racket balls? Racket balls?
Yeah, same thing as the
Because it's so hard. Like I'll get this little knot in my back, and I'm like, I have used every effing ball out there, and nothing except for a racket ball will
get in
actually
there.
like get in there. I
Yeah.
poked holes in like drywall,
Damn.
pressing on it so hard.
Okay.
Yeah. So I mean, I try.
Yeah. Same thing.
It's the same logic though.
Same logic. Yeah.
Okay.
Spend no more than 5 minutes, like I would with the percussion gun.
Just getting
right?
in there.
Because
loosening
again,
it
you're
up.
just pushing hard, and it's not probably helping.
Okay.
And a lot of the time, where we're feeling pain isn't the root of the cause. The cause
Okay.
of the root cause. So right, like maybe I'm having like base of head like pain, right? But it's coming from my shoulder, right?
So there's always that. Yeah. So
Yeah.
like I'll have a shoulder blade, but it's actually my pec is tight
Exactly,
or
right?
something like that because it's pulling me off
Exactly.
center or something or
Yeah.
whatever. It
You want
would
me
be.
to blow your mind for a second?
Yes.
So you got pec major, right?
Yep.
You know pec minor, the little guy.
Yep,
Have you ever seen
right
that
here.
one? It attaches from the ribs back to your shoulder blade.
Okay. So there you go.
Yeah. So there's something called a coracoid process. That's like a little crow's beak that comes. So you got your AC joint, and then right underneath here is your coracoid process comes forward. Your pec minor hangs onto that, and it does.
And it rolls your shoulder,
Yeah, it does
which
a
pulls
little
on
bit
your
of.
shoulder blade. God damn.
Yeah. So now
See?
we're here, right?
See, we're learning something here, people. That's the whole point of this.
Exactly.
Absolutely.
Yeah.
No, that's awesome.
Yeah.
So got that foam rolling, got that. Got that. We're just checking off all the questions I have.
Let's go.
So one of the things I want to kind of this is getting out. This is getting into like the training portion of it, and
Yeah.
being cautious is one of the things. But it's not like we're adults. We know where our limits are for the most part.
Yeah.
But parents preparing kids to start training. I've seen a few like on your site and stuff like that kind of recently where you have some kids out there
Yeah.
that are going through some physical therapy and stuff like that. I have a family member that son's extremely good football player. He's a giant,
Oh.
right? And he's like 16, 17, right? But this was when he was like 14. He was deadlifting 1,000,000 pounds, squatting 1,000,000, and he's a big kid. I mean,
Yeah.
but I always think of it as like, okay, there's still growth plates happening. There's still things happening. He's still growing, and it's being, I don't want to say it's not overprotective, but protective of if you have a child that's going through some of this, and parents, like kids are into sports, and I was into skateboarding. I was in a lot of solo kind of
Yeah.
things like you.
Yeah.
I moved around with my parents. We were in the military, or they were in the military. So
Yeah.
I didn't get to play team sports that
Yeah,
often,
yeah.
right? So, but I wasn't powerlifting shit at 14 years old either.
Yeah.
Right. So what are some of the, things that parents maybe should be cautious of? I know we're shifting a little bit here,
Yeah.
but I wanted to make sure I touched on this.
Yeah.
For overtraining children, right?
Yeah. So
What's an age where it's just like, okay, you're good. Maybe,
Gotcha.
I don't know.
So I wouldn't say there's an age. There's definitely a skill level,
Okay.
right? So what 10 is kind of the age where they're old enough to comprehend, movements really well and understand the game really well, and maybe start making those decisions on the field, and right. They understand what they're doing.
Yeah.
So that we can probably move them to the weight room and start teaching them stuff.
Okay.
Now, we should before, and the thing that drives me insane, there's probably a couple factors that get pushed really out the gate is parents are putting their kids in sports all year long. So
There's no downtime.
there's no downtime. So Timmy's playing baseball all year long, right? So
Not
he-
resting his arms.
not resting his arm. So we're having this like huge influx of like little young, 10 to like 14-year-olds getting Tommy John surgery.
That's the injury that comes to mind.
Yeah, because they're
throwing 100 pitches a day.
Yeah.
Or whatever.
Yeah, because they think that's going to make them better, right? Your son, I hate to say this, is 10 years old. He hasn't hit puberty yet. Maybe focus on something else for a second. That should be quality movements in the weight room or on the field, right?
Okay.
Let's maybe not push the weight, but the quality of movement.
Build the skill versus the weight.
Yeah.
You can get strong later.
Exactly.
That's kind of that's my theory of it. Is like you can, or the logic. I've worked out my entire life.
Yeah.
I've seen like there's some guys at the gym that are younger. Some of them are gigantic, but as they've gotten a little, even a past couple years, you're like, that dude went from being a little dude to now he became, like, you see puberty hit that kid.
Yes.
And now it's different game.
Yes. So I always tell parents they should be a good mover prior to puberty.
Okay.
Because once puberty hits, those hormones come in, right? Now we're having those testosterone spikes. We're having all these like influx of like, hormones. So we want to make sure they got these quality movements before they're kind of essentially being meatheads and just lifting just to lift stuff, right?
Right.
With no transfer into the sport.
This was what kind of made me think of this is when I was having a conversation with the parents is, well, the trainer said that he can do it. And I'm like, yeah, but is that right? Yeah. Just because he's a big guy, he's going to be a big guy the rest of his life. Yeah. And you want his back to be there the rest of his life.
Exactly. Right.
Not when he's trying to get into D1 football and he's a sophomore in high school. I understand but he's a big dude anyway. Yeah. So he's already got that on his side.
Yeah.
Right. But that makes sense that focusing on the movement, becoming a professional at that.
Yeah.
Very, very good at clean. I mean, if it is clean and press or something like that, is do it lightweight, but just get get it down.
Yeah. Or start with a kettlebell or a dumbbell.
Yeah.
Right. Modify the movement based on their skill level.
Yeah.
And that's huge because you want them to have some good training skill level for them. They should be able to comprehend the gym. They should be able to take instruction. They should be able to take feedback. So let's say Timmy does make it to college, right? He does get that scholarship. Right at the gate, he knows how to work the weight room.
He's done. That skill's already built.
Yeah. So coming from a strength and conditioning coach that was in the college setting, you tell who's been in the weight room and doing good quality movements, who's been lifting just heavy, just
pressing
doing
shit
nothing.
up.
Yeah. And who has no idea what to do in the weight room. So the ones that don't know what to do in the weight room are the slowest to learn. So now we have to teach them, how do you move?
But are you better off teaching that individual than the one that's been in the weight room just pushing?
Yes.
I mean, sometimes,
from
right?
a quality of like life and long-term learning.
Yeah.
But from a recruiter, maybe they're trying to go pro.
I follow.
Not really, because now they're
at least they're starting with the strength, even if that you can correct form and shit like that.
Exactly.
Okay, that makes sense.
So
still don't do that.
Yeah.
Still get them the right instruction. Get them a good trainer.
So I like to tell parents, it's like you have your child's a car. Right?
Yeah.
You've been taking them to practice every day. They're having 5-6 practices a week. They play year long. There are multiple tournaments. There are multiple clubs. You are building their engine, their gas tank. When are you going to build their brakes? When are you going to build their chassis, right? The drivetrain, right? When are you going to get them to learn how to decelerate? All you've been doing
is need some downtime.
They need some downtime. They need to know when to slow down that engine.
Yeah.
Right. And then build from that. Right. They need bigger tires. Right. I like using car analogies.
It's just an analogy. Yeah, that's cool. Yeah,
so
absolutely.
You can't just build the engine. You have to build the other structures around that make a full vehicle.
Okay.
Right. And because that's where the injuries come. Right.
It's when we get overtrained. Like, I'm old enough, but even if I go a few times extra a week, like I'm training up for a tournament or something like that, for me physically in jiu-jitsu, I'm overtraining.
Yeah.
Right. Yeah. And it's just because number one, my age. Number two, it's just.
Yeah. And you have a job. You're not a professional jiu-jitsu guy.
Exactly. Right? I'm doing this for fun.
Yeah.
Right.
You're not like doing, the pro dudes, Russell Wilson spends $1.7 million a year.
Just on training. Yeah.
On just like, if I was his chiro, right? $1.7 million, that'd be awesome.
Damn.
I know, right? But those pros,
TB12, Tom Brady,
exactly,
created his own company just based around that.
So, you know, when people
That's
are like,
Matador in a couple years.
I hope so. That'd be awesome.
Damn right.
I mean, but yeah, I mean, these professionals are seeing providers 2 to 3 times a day.
See, that's
even
insane.
More.
Yeah.
It's insane. And like, not for like 30 minutes, not for 15 minutes,
an hour here, 2
hours, right? So that's the difference when people are like,
oh, that could also be their downtime too.
Yeah.
That is their downtime. That's their
downtime.
rehab time.
Yeah. You know, but again,
getting their body right.
Exactly.
Because when you have $100 million contract, you have to take care of that car.
Yeah.
That motor.
Exactly.
All the other shit that goes into it.
Yeah. So it's just like, take care of that. It's wild.
No, that's awesome.
Yeah. I forgot.
It's all good.
Yeah.
No, it's all good. All right. So it comes to the point real quick. What that I try and, bring back a lot of this is, it's really important for people just to think of, be mindful of like what we're doing. If it's doing cold plunges, you're doing sauna, you're doing all of these things that I'm starting to learn about, right? Over the past, several months and shit like that. And, it's just, again, that's to everybody. That's why I want to do these under health and fitness. It's because it's important to me. I think it's important to a lot of people that maybe they just don't know who to go to or ask, right? Yeah. So, one question, kind of last question for you, and then we'll get into like, where can people reach you? What's a really proud moment for you? Like, what's the proudest moment you've had so far in like a professional career?
Definitely opened up Matador. I mean, that was a lifetime.
Yeah.
It feels like a lifetime dream. And now that I'm in it, I'm like, it doesn't feel like it. It's crazy. It's surreal to a sense.
You're actually the guy doing what you love.
Yeah, exactly. Yeah.
Isn't that cool?
It's like what 18-year-old me was thinking at the time. It's like, I'm going to be the provider, providing care to athletes. I'm going to be fixing people. I'm going to be improving the quality of life of people.
Mm-hmm.
So it's just crazy to like sit back sometimes and like have a patient be like, thank you so much. And like, damn, it hits me.
Even I do that. Yeah. I'm like, dude, oh my God, you fixed me.
And I'm like, damn, like that's
good.
That's what I wanted as a patient, to come off the table and be like, thank you.
That's awesome.
That was awesome. But I remember like this, Matador's been open. We're in our second year.
Okay.
Right. I remember before opening, I had just painted the walls black in the very back, and the logo went up. The big vinyl sticker that's in the back when you walk in, you see it. It's Matador RP.
Same one that's on the screen right now.
Yeah, that sucker. And the turf had just put it in the middle, right underneath that logo. And I remember just looking around and being like, "This is all me. Like,
it's all you.
I can't believe I did this. Like years of planning, like it came into fruition.
Yeah.
Right? Like the tears and debt and the fails and the wins here and there. Like it hit me. I was like, damn. Like I got a little emotional at the time. And I was
damn
like,
right. Yeah.
I was like,
it's a lot of hard work.
Like if you go into Matador and you're ever in there, just know that like every inch of that has been touched by me.
And every inch, and it changes. Like each time I go there, you've got a new thing set up in a new way. Yeah. Like you're constantly trying to make it better. A better space.
Exactly. I'm trying to maximize every patient visit.
Yeah.
Right. I am trying to offer you the best care that I can provide you. Right. Whether it's the best rehab tools, whether it's the best modality, I want it for my patient. Right. So, like every business struggles to kind of come off the floor. Right?
Absolutely.
Right?
To get the start.
Yeah.
Right?
Yeah.
It's like we were talking before the show. You're like, I've got to do some marketing things. I've got to do. You're not just doctor. It's also marketing guy, communications guy, director of this and a director of that, and hiring manager and all the shit. Right.
It's a lot. Right. And then some days there's been only like maybe like 2 days where I've gone home and I was like, today sucked. Right. Like,
some days we just have those.
It just has. Yeah. I had a patient that maybe didn't have the best outcome. Right. And I had to send them out for MRI, maybe pain management. And then like my marketing is not where I want it to be, but then I step back. I'm like, dude, you're doing what you love. You're doing what you wanted to do. Like
you're just not hitting those goals. Like not every goal is going to hit. Right.
Exactly.
That's fair. And that's fine. Like, that's life.
Exactly. And that was the biggest thing where I was like, take a step back, take a breather, man. You're only one person. Like,
right.
We're in year 2. It's Matador's doing great.
You just hired your second.
Yeah. Yeah.
Your first employee, right?
First full-time employee.
Full-time. Okay.
Full-time employee. And then we're in the process of hiring a part-timer and then hopefully a couple more massage therapists.
Nice. So it's it's
It's
just a
constant
slow
growth.
roll.
Yeah.
Yeah.
So I don't know when the last time you were there, but we added like a third room or
No, I only
Yeah.
see
it's in-
exactly.
it's under construction. And then hopefully a fourth room that we got planned out. It's a little more sketchy, but
It's all right. But that's awesome. No, it's awesome. And that congratulations on that, because that is, you saw it through.
yes.
Right. So, hey, cheers to that. My dog's
thank
even
you.
like that.
Someone
Yeah.
just knocked.
It's the kids next door. So, or it's somebody, I don't know. Anyway, yeah. Where can everybody reach you?
So on Instagram, there's the Matador RP.
Okay.
Instagram, which is the clinic Instagram, or you can go to Load Your Tissues.
Load your
Yeah,
tissues.
That is my personal account. Yeah, it's load_your_tissues.
Okay, so we'll put everything out in the description for this podcast.
That one's usually pretty fast. If you just send me a DM, I'm available. Or if you just visit our website, matadorrp.com.
Okay.
You can schedule a visit there. It's super easy. We're paperless.
Everything's easy.
It's
Like I scheduled one at 1 a.m. one time or something like that, and I thought it was for the same day. It was for like and he got all screwed up, but I was able to do it, and I showed up, and he still took care of me, and I was a day early, so it was awesome.
Yeah.
Dr. Elias, I said it wrong.
No, you said it right.
Elias, all right. I've been worried about that the whole time. Thank you so much for spending time today. Sure. It's been awesome to have like a deeper conversation than usually. I'm just on a table face down screaming or laughing or swearing usually is kind of how it goes. But thank you so much for getting into this with us and talking about some details. And I think a lot of people will benefit from this. Good. And then we'll continue talking more and we have you back on.
Oh yeah, I love it, man. Thank you guys so much. Check me out and keep listening to the podcast.
You got it. Thanks so much, dude. Take care, everybody.